Hi, I'm Dr. Robert Berry, and I'm an orthopedic sports medicine specialist. One of the things that I'm often asked about are meniscus tears and what we use to treat meniscus tears, how long it takes to come back from surgery from a meniscus, and if after having meniscus surgery, am I more prone to arthritis? So those are some of the things that I wanted to discuss and answer for some of our viewers and patients. Meniscus are little cartilage discs, little cushions if you will, that sit between the bones and our knee. What happens is those cartilage discs lose their blood supply as we age past adolescence. Meniscus has such poor blood supply that, unlike other areas of the body, when they're injured, they really don't heal on their own. And so often they do require surgery if they tear to the point where they're actually catching inside a knee. So one of the things that people will notice first with meniscus tears is pain and then often catching and swelling in the joint. Sometimes what will happen is the knee can actually lock, and then it makes it nearly impossible for someone to walk on that. With small meniscus tears, you certainly can try physical therapy and anti-inflammatory medications first and see if that is beneficial. When the tear is bigger or is locking and catching, that often requires surgery. The good news is that arthroscopic surgery actually has revolutionized the way that we treat meniscus tears. In years past, people would often end up with large incisions over their knee where the majority of their cartilage disc or meniscus was actually removed. Now with arthroscopic techniques through small little poke holes in the knee, we can go in with a camera and just simply trim only the injured area. If the injured area is less than 50% of the knee, then usually people are not necessarily more prone to developing arthritis if the majority of the meniscus is preserved. We certainly always try to preserve as much of that meniscus as possible, since it certainly helps to decrease stresses on the knee itself. One of the other things that sometimes will happen is we will repair a meniscus. That means that if the meniscus tear is in close proximity to the blood supply, usually within a millimeter or two, and certainly is what we call a vertical tear, so a very clean type of tear, we can sew and repair that. The issue with that is it does slow down rehabilitation, but all of us orthopedic surgeons would probably agree that whenever you can preserve cartilage or the meniscus, that's certainly a good thing. We always try to do that. Sometimes it's not possible to do that, and so then we have to do what we call a partial meniscectomy, and that means to remove part of the cartilage itself. Once someone's had arthroscopic surgery for a meniscus tear, we usually try to get them started in physical therapy within usually 24 to 48 hours. Once they start in physical therapy, they work on weight-bearing activities and work on regaining their motion. The therapist will often work on certain things to decrease swelling using compressive wraps and sometimes electrodes in order to decrease swelling and to help decrease pain. There's many things that your physical therapist and your doctor will recommend for you after meniscus surgery, should that become necessary. Hopefully, if someone does have a small meniscus injury, it can be treated conservatively and that no surgery will be necessary. Ultimately, though, whatever is best for you will be determined by you and your doctor. Thanks for listening in. I'm Dr. Robert Berry.